Hi everyone, I'm Erica Zummel, social media editor at Beyond Type 2. Our mission is to help people with type 2 diabetes by sharing practical resources and tips on how to live their best lives with the disease. Also to take on and dismantle any stigma and stereotypes associated with type 2. We do that by amplifying and lifting the voices of those in our community, and one of those voices today is going to be Tobi Ditmore.
I had been pre-diabetic from a physical in 2016 and got into great shape, got really healthy, went into the doctor last September to get to try to get a prescription for high blood pressure because I knew I had that. Did a complete physical, and from that physical, I found out that I had diabetes type 2.
And what were some of the symptoms you had when you were diagnosed? Did you have any?
I didn't know that they were symptoms, but one of the reasons the doctor, my primary care physician, requested a full lab work was because I had been rattling off things that were occurring with me. And so she thought that I might be diabetic. They were specifically, I was dehydrated all the time. I did have frequent urination overnight, which I actually knew that that was a diabetes symptom, still didn't think that I had it. I like wounds on my hands specifically would take a really long time to heal.
So what was your primary care doctor's sort of course of action after that, after you were diagnosed?
It was a really bad experience in the first place. And I just want to share that because it was very overwhelming. And if you don't have friends or have people in your life who are open about their diabetes, you're not very knowledgeable about it. And as a result of that lab work, I was called by a nurse who said, "We'd like to schedule a follow-up appointment with you so you can come in and talk to your doctor about your diabetes." And that was how I found out I had type 2 diabetes. So it wasn't a great way to start off this new chapter in my life. And when I went in, I should have, knowing that that's what I was going in for, I should have done some more research. So a little bit on my part, I should have been a little bit more knowledgeable because right away, based on what my A1C was at the time of diagnosis, 12.7, I was put on insulin, metformin, thyroid medication, cholesterol medication, and high blood pressure. So that was all in one visit that I was given that information. And I was also referred to a diabetic educator.
Definitely an adjustment. So, I'd love to hear what was, I guess next for you in that stage of your diagnosis.
Yeah, it was, especially the insulin. That was particularly upsetting, having to give myself injections. My husband and I talked a lot about it. He always did not feel like that this was the best course of action for me. It was just his gut feeling. I started doing research and, I would say to him, "Well, I'm reading on the internet and this is what people do." And he just said, we're very privileged that we get to have insurance. So I really would feel better if you had a healthcare team that included an endocrinologist. And I didn't even know to do that. He had heard it. He has a friend who has type 2, and that person told him that's what he did. And it was the best decision that I've made so far in this journey, was going to see an endocrinologist.
What is something you wish you knew when you were first diagnosed?
I wish I knew that I had an option. I'm very fortunate that I'm in my 40s and I've not had medical conditions in the past where I've had to, go see specialists. I'm really fortunate for that. So I honestly didn't know that I had an option to go see a specialist. And again, I have the privilege of having insurance, and luckily I don't have to have a specialist referral. So, and I didn't know that an endocrinologist was a diabetes doctor. Like, I just wasn't informed. And I mean, to be honest, I'm not a person who doesn't want to be informed. It's just so overwhelming, especially as high as my A1C was. And here I am thinking, God, I'm the worst type of diabetic. Like, I've got to get this down. I've just got to take everything the doctor's telling me to. I mean, my endocrinologist took me off of insulin immediately, based on just 30 days of glucose readings. And so if I hadn't gone see her, I might still be doing insulin injections to this day that are not necessary for me. So there's so much that I wish that I knew, but I think you just have to find the best way to get the information you need, whether you need it a lot of it at once and then you pick it apart, or whether you want it just parsed out to you.
You knew your body and you knew what was going on, and you kind of felt better in that, like, thinking once your endocrinologist sort of confirmed it, or, was it just like, okay, this is what I have to do now, and kind of just, grab the bull by the horns moment?
That's exactly right. I definitely just thought I just need to do what I am being told to do by a doctor in this moment. It was only a 30-day period. I went to see an endocrinologist 30 days after my diagnosis. And so being put on insulin, I will say this, like I personally didn't think the things that I know there are stigmas about having type 2 diabetes. I didn't think people who have type 2 diabetes are lazy or overweight. Like, I didn't think it was a specific type of person. I knew that it would had to do with insulin and hormones and your pancreas. Like, I knew enough to know that I had to do that. So being put on insulin, I mean, I was upset that my A1C was so high, but like, I didn't really think like I did anything wrong. I just thought, okay, my body's not cooperating. So what can I do to get it to cooperate?
How important is staying active to you?
It's probably it's the most important of my diagnosis. Even before nutrition, being active is the most important because it covers really two components of my life and how I am prepared to deal with being a diabetic. And that's, my physical just well-being and mentally. So I was actually a very active person. I have been since 2016. With the pandemic, I slowed down a little bit because I wasn't going to group classes, but I started exercising at home, not really with any consistency, but I was doing it. But when I got the diagnosis, I wanted to make sure that exercise actually contributed to helping manage the diabetes, maybe even helping to improve it. So I read a lot of articles about how workouts and specific type of workouts could impact my blood sugar. I mean, I knew that overall staying active was going to be good for me anyway. So I did look at that, and so I'm really focused on strength training in addition to getting cardio work. But I just love going to work out because I really get so focused on it that it takes my mind off of everything. I have a dog with cancer. It takes my mind off of that. It takes me off my diet. It takes my mind off my diabetes. And so I get to like unplug and recharge, and then I get to come back a little bit stronger physically and mentally every time. So it's super important to me.
You like to go on walks a lot, I know, as well, with your dog.
Yes, I really do love walking. I used to run. I used to do lots of races. It was just too hard on my body. It's just not really suited for me. But I love being outside and I love going long distances. My dog has 3 legs, so he can't really walk with me. So I push him in a buggy, and it's just a lot of fun. We go out together.
How has your freestyle Libre helped you with that?
I mean, I love it. I experiment with it a lot. I mean, that's the best part about it, is that you can see how everything affects your glucose, your blood sugar levels. And I mean, I will experiment with it from day to day. I'll take a pre-workout, or I won't do one, or I'll just do a bike ride versus strength training. And I like to compare it. I mean, obviously it helps you make good food choices too. But for me, I definitely have enjoyed just looking at the data from it, about how certain types of exercise affect my body. But I mean, it's super convenient. It really was a game changer for me. And I wasn't going to do it because I kept hitting it. I kept knocking it off. And so after the second time, I just told my endocrinologist, I'm just going to do finger sticks. In about 3 days, after that, I was like, I've done it 5 times every day. I'm not. So I was really glad I finally stuck with it and was able to, get it to work for me. And now I will tell anybody who will listen that they should have this device.
Did your doctor explain to you when you started with the Freestyle Libre about like time in range and time in target and how that relates to your A1C, things like that?
She didn't, but that was by request. So as I said earlier, like I told her I specifically need information in small pieces. And I mean, that could be to my detriment since I only see her every 3 months, but I'm not even 6 months in. So I'm, like I said, I can't get overwhelmed. It's just stress. Causes a stress cycle for me. So we have not discussed it. I read up on it. And there was a recent post on Beyond Type 2 that did a really good job of like explaining what that is. So I will have some questions when I go back in, some data I want to share with her, obviously. And I feel more prepared to be able to discuss this with her now.
But so far, would you recommend the Freestyle Libre or any CGM really to other people living with diabetes?
Yeah, absolutely. I have a friend who is pre-diabetic, and she asked me if she should ask her doctor to prescribe one for her. And I just said, absolutely. Knowledge is power. This is something that's just very convenient. I mean, when you think about diabetics, 20 years ago didn't have this, and we can just make so much better choices with the more information that we have. And I mean, to be honest, finger sticks are the worst. They're just the worst. And this is just so much easier. I mean, especially for being on the go, getting to check it. If you feel a little off, check it, immediately. And you can see what's going on with you. So I would highly recommend it.
Really, just to end our conversation, I'd love to hear if you have any words of advice for people that have been recently diagnosed with type 2 or anything that you feel like our community, would like to hear, even if it's just words of support.
First, you need to sit with it for a little bit, and because I just can't imagine it's not overwhelming to anyone to get that diagnosis. But I think you just have to sit with it for a little bit, really figure out what your needs are. And I think, honestly, I have found a tremendous support in the Beyond Type 2 community. I will hear things I've never heard before. So, I learn something new. I get to participate in knowledge that I've gained. So, I mean, even speaking about the CGMs and the adhesives, someone posted the other day, how do I get this dang thing to stay on? I was able to contribute to that conversation. But, that person saw the value in going there and asking the question. And it's a place where you don't even have to be brave. The vulnerable is welcome. You go in there and ask questions. Support is going to be the biggest thing. Your family members and your friends will support you, but they do, if they're not type 2 diabetics, they lack a little bit of context. And so it's just great to have support. It's great to have, be in a community of people who you have something in common with. And it really helps take away like some of that, some of the myths and the stigma that go around it. And you'll find all different kinds of topics that are covered. So, I mean, that's probably my biggest advice is find a community, find support, because you're not alone. You're not alone if you're overwhelmed. So just go to the community.
Follow Tobi's journey on Instagram and be sure to check out resources for living with type 2 on beyondtype2.org and follow us at Beyond Type 2.